Director of Production Strategy of Medi Assist, to please come and address. A round of applause for Mr. Prashant Jhaveri, please.
And good afternoon to all of us. I have to admit I haven't heard important in my context so many times, so thank you very much. There were two promises that I was asked to make as I walked up to the podium, saying, one, please help us save time. Two, we're running really, really late, and please keep it short. So I promised to make sure I abide by both those promises. Medi Assist, right behind me. We're Health Insurance Benefits Administrator. I'm proud to say that while we're 15 years old, we see ourselves as a 15-year-old startup. And we today service close to 11 crore Indian citizens across the country. Those are the lives we touch every year. I think our mantra and our focus areas have been three key driving forces. One, scale. Second, transparency. And third, trust. I think when it comes to scale, I think India in that sense is synonymous to scale. If there is anything that does not have the ability to scale, touch more lives, I think it will only have a limited impact over a period of time, one. Transparency is number two. I think when it comes to healthcare, I think from the point of view of cost of treatment and quality of healthcare, I think those are the two areas that still stay very opaque in the Indian healthcare and health insurance context. And thirdly, trust. And I think trust as a theme has resonated across all of the sessions earlier today. And I think the fundamental objective for all of us is essentially to move from a stance of, you're guilty until proved innocent, to a stance which says you're innocent until proven guilty. One important statistic that I will leave with you is, even if you take the government of India, I think the clear focus has been to leverage health insurance as a means of financing healthcare in this country. Healthcare, yes, is a constitutional right. Yes, it is important to set up healthcare institutions, but I think in a country as complex, as diverse, if you don't solve for the healthcare financing paradigm, I think it will just take longer for us to be able to solve for healthcare infrastructure, which is government-backed, which is why government is using health insurance as a very important vehicle and a tool to be able to solve for the healthcare financing problem. The statistic that I spoke to you about that I will leave you with is today, in the context of Indian health insurance, the incidence of claim, which essentially means you and I essentially availing a health insurance benefit, is for each of us once in 8 years. The reason that happens is health insurance predominantly today solves for catastrophic care, solves for healthcare financing if you need to get hospitalized. If I were to tell you what the statistic looks in much more evolved healthcare economies outside of India, the number of times an individual essentially avails a health insurance benefit is 16 times every year. So the paradigm shift is going to be once in 8 years to 16 times every year, because that's when you essentially are solving for the significant out-of-pocket spend that all of us are incurring in healthcare, everything from solving for consults and going to a specialist, to solving for prescription meds, to solving for health screenings, to even essentially getting an off-the-health treatment done in the primary care or outpatient context. So there it is. I promised 180 seconds and I'm running out of those. But thank you everyone for listening. And if you need to know more, mediassist.in. Thank you very much.
Thank you, Mr. Prashant, and with all the apologies again, but with a lot of respect, we want to give you a memento for speaking in this session, not in the session, for being a speaker in this conference. I request my team to please get these speak mementos. I request Dr. Priya Balasubramanian Kakkar of PHFI to please present a memento to Mr. Prashant Jhaveri of Medi Assist. At center, please. Round of applause. Thank you so much.